Today I'm going to be demonstrating an extraoral exam on my patient. So I'm going to be checking her overall appraisal and general appearance. I'm going to make sure she's sitting upright with her feet flat and ask her to remove any eyewear or hats. And I'm looking for any lesions on her skin and any unusual recession of her hairline. And I'm going to start behind her and do her temporomandibular joint. So I'll do light pressure and circular motions, and then I'm going to ask her to open her mouth. And then I'll ask her to shift her jaw from left to right, and then forward and backward. And so I'm really looking for any tenderness or swollen glands, nodes, any inflammation that could be a sign of infection. And then next I'll move on to her parotid gland, and I'm going to ask her to clench. Okay, and then I'll move on to her submandibular gland, and I'll also palpate for her submandibular node. And then her submental gland, or node. And I'll check her thyroid gland, which will be about right here, and I'm going to ask her to swallow. Next, I'll do her cervicular nodes. So by this, I'll have her turn to her left, and I'm going to be palpating her sternocleidomastoid, and I'm checking for the medial or posterior nodes using light pressure. And then I'll ask her to turn to her right. Next, I'll check the supraclavicular nodes. So that's going to be right above her clavicle. Just use light pressure. Okay, and then her preauricular nodes will be right in front of her ear. I'll do her postauricular nodes. And then lastly, her occipital nodes. So I've noticed there's no inflammation or tenderness, and she passes the exam.